many of you would agree that we have a healthcare crisis in America? Okay. So is it a healthcare crisis or is it also a health crisis? It's both, isn't it? Let's talk about the health crisis first. In other words, what can we do as individuals to improve our health? What can we do as individuals in our society to better our health? What kind of things can we do?
We need to be more proactive.
We need to be more proactive.
Better care of ourselves.
And how do we do that?
Exercise.
There you go.
Diet.
Nutrition.
Nutrition.
Yeah.
I think even to be responsible for some of our healthcare decisions. We
Yes.
have to be, because your doctor says this is what you should do, you really, with the internet and smartphone, that's not an excuse. You can look it up. You can check it out.
You know, that's really an interesting point. You know, I've lectured for a number of years now, and nobody else has said that yet. But here's the truth of the matter. You're the boss. You can hire him, and you can fire him. And they need to start listening to you and your desires. We've got to start taking control of this process. So we know we can do things different. We could probably reduce our stress a little bit, maybe go for walks, visit nature, things like that too, right? Why do you think this healthcare system is broken? What's wrong with this system that we've got?
Not focused on preventative, and it's focused on cure.
Crisis
surgery,
interview.
right, after
Yeah.
the fact.
Right.
Pills and surgery.
So we're symptomatic relief. We go in to the doctor, he treats a symptom with a medication or a procedure. What else is wrong with the system? Why is it broken?
We follow what our healthcare will pay for.
Okay, insurance pays for certain things, doesn't pay for other things, right?
And I think most of us here are kind of at the beginning of this entitlement. We're putting our life in somebody else's hands and forgetting it's our lives.
That's right.
We expect them, and even malpractice. I'm just going to go there.
Okay, go
I
ahead.
worked in hospitals for a long time. It's up to you
Yes.
to say yes or no, yea
Right.
or nay. I mean,
Right.
you can't expect.
So again, it gets back to self-responsibility, doesn't it? So let's just take a look at a few things here. Is America healthy? We make up 5% of the world's population. We spend more than all the rest of the countries combined on health care. Our 5% spends more money on health care than the whole rest of the world. We consume over 55% of the world's medications. Just watch the evening news. How many medication commercials are we going to watch, right? They've got a remedy for everything, but they also have a list of side effects, don't they? So,
You gotta take something for the side effects.
and then you got to take something for the side effects, yeah. So we're not unhealthy because we don't have enough drugs in our system, right? We probably have way too many, okay? So this is Barbara Starfield. She's an MD and a Master's of Public Health from Johns Hopkins University. And she published an article in Journal of American Medical Association back in July of 2000 on the effectiveness of American health care. So she discovered the third leading cause of death. So who knows what the leading cause of death is in America? Heart disease. What's the number 2 cause of cancer? Does anybody know what the number 3 cause of death is? Medical treatment in hospitals only. That doesn't include clinics. That doesn't include outside of clinics. This is just hospitals only. 106,000 people pass away each year from properly prescribed and properly taken pharmaceuticals. Properly prescribed and properly taken pharmaceuticals. 80,000 hospital-caused infections. In other words, they go to a hospital, they don't have an infection, they don't get out of the hospital. Or they get out of the hospital and die from an infection they got in the hospital. 20,000 from hospital errors, 12,000 from unnecessary surgeries, 7,000 from medication errors. Okay? So, big problem. The study was repeated in 2013 of the 17 highest income nations ranked according to their health again in 2013. Now Barbara Starfield was supposed to participate in this research project. She unfortunately passed away due to a complication of 2 medications she was taking. So the exact thing she was studying that she discovered way back in 2000 is what she passed away from. So they look at all these countries, and where does the United States end up? Last in almost every category. Almost every category. Yet we spend more than the rest of the world combined on health expenses. The study was named the U.S. Health Disadvantage, because that's the situation we're in now. And so what is our purpose here tonight? Tonight we're going to begin to tell you about this alternative care that is probably, again, going to be the biggest medical breakthrough of our lifetime. That's going to ease a lot of suffering for a lot of people and avoid unnecessary surgeries. Because this treatment that I'm going to describe tonight helps shoulder problems, bursitis, arthritis, rotator cuff injuries. Now sometimes we'll need surgery for some situations. I'm not saying that. But for situations that do not respond appropriately to surgeries, this can be an alternative. Now once a knee replacement has taken place, I'm afraid there's not much we can do for that. So we can help knee pain, we can help elbow pain, hip, foot and ankle pain, we help arthritis, and you'll see a testimonial tonight of somebody who's had arthritis not only in their knees, but their wrist and their fingers, and their fingers are beginning to straighten out. And she can play the piano without pain. So we use a team approach. What does that mean? Well, we're looking for results. It's an integrated medical approach. MDs, nurse practitioners, chiropractors, exercise and rehab, weight loss and nutrition. We bring it all together. So you get the best of both worlds. You get the best of conventional medicine, and you get the best of wellness care. And most importantly, you get to drive the bus at our clinic. You're the one who's in actual control of determining your destiny relative to wellness. So this is me. My doctorate is in chiropractic. My postgraduate education is in functional endocrinology, the study of the functions of hormones. Functional medicine, which gets at the underlying reasons of why do these chronic diseases develop in the first place? How can we get to the underlying cause of why people get sick in the first place, rather than just treat it with a medication once it happens? I mean, why does high blood pressure develop? Does it just all of a sudden show up one day? Or is there a process in how this works, and maybe if we catch it early enough, and even if people are on medications, can we begin to get them off safely and effectively? In many cases, the answer to that is yes. We help reverse diabetes, we put autoimmune conditions into remission, digestive issues, all of this without medications, unless they're absolutely necessary. And sometimes medications are necessary. Sometimes medications can save lives. Sometimes surgeries can save lives. Okay. I also have postgraduate education in functional brain-based neurology. Do we have a problem with brain-based issues in our older population today? Do we have healthy brains as we get older? No. What's happening with Alzheimer's? Like this, isn't it? In fact, that disease alone is going to bankrupt our society unless we get at the underlying reasons of why it's happening. What's happening with the brains of our little people today? What's happening? What's happening with autism?
Got friends that got kids with autism.
Yeah, I mean 1 in 45 now. And these numbers are going like this too. And that doesn't count dyslexia, ADD, ADHD, tics, Tourette's, those type of things. That's just autism. So we have to begin to address, why is this actually happening to us? And does anybody know what the underlying cause of all chronic health issues are? Has anybody heard of that? It's called inflammation. Who's heard of that? Right? So tonight you're here because of joint inflammation, right? Okay, it hurts. But inflammation, all doctors, all scientists know that inflammation is at the root of all chronic degenerative diseases. It doesn't matter whether it's Alzheimer's or type 2 diabetes or autoimmune conditions or cardiovascular disease. It's all inflammation. And so when we talk about inflammation, we're talking about an immune system that has become dysregulated, disorganized, and confused. And who knows where 70 to 80% of our entire immune system lives?
Intestine.
In your gut. In your gut. This is the outside world inside of our body. So my intestine, small intestine of 24 feet, 6 feet of colon, goes out into the yard out here someplace. If you were to fillet my intestine open and spread it out, it would more than cover the entire surface area of a tennis court. One microscopic cell under that mucosal layer is where our immune system lives, 70 to 80% of it. And so, do you think what we put in here may have an influence on that immune system? Absolutely. All right. So we can get inflamed with bacteria, we can get inflamed with viruses, we can get inflamed with environmental toxins. Do we live in a toxic environment? Yeah. Since the end of World War II, 85,000 different toxins spewed into our environment. This is not the same as it was 200 years ago. We have a lot more environmental stress, too. So, if we want to get at the underlying reasons of why these chronic health issues develop, we have to get at the underlying reasons of why our immune system is becoming inflamed. And so that's what functional medicine helps us do. I also have postgraduate education in nutrition and fitness. I'm quite a fitness advocate. But this is me. I still play this silly little game called softball. I've got 8 world championships, senior softball. And over the years, I've beat my body up. I've had surgery on my left knee to remove torn meniscus, surgery on my right knee twice to remove torn meniscus. First surgery on the left went just fine. Surgery on the right, first one went fine. Second one, not too good. 5 dislocated shoulders, labrum tear, no surgery. I had the amniotic allografts in January. I can tell you it's absolutely phenomenal, the results that I've received. And we've done multiple injections at our clinic, and so far we're batting 100%. Now, when I say 100%, everybody's improving significantly. This is not a panacea. If some doctor tells you this is going to rejuvenate everything in your body, run the other way, because they're full of beans. But if you want to reduce pain, if you want to get rid of scar tissue, if you want to start regenerating some cells in your damaged joint, this is what does it. That's why this is going to be the biggest medical breakthrough of our lifetimes. So here's a joint, typical. This is a bone, this is a bone. Here's cartilage, cartilage. Cartilage is not supposed to touch cartilage. There's synovial fluid in there. There's no vascular supply to this synovial fluid, so it gets nutrients through imbibition from the outside. Now, years ago they used to say, if you've got arthritis, just rest, right? What do they say now? Exercise, right? But sometimes that hurts, doesn't it? Sometimes it hurts too much to exercise. We have a couple of rules regarding exercise at our clinic. Number 1, no pain allowed. Number 2, you actually have to enjoy it. Because if you don't enjoy it, what's going to happen? You're going to stop. It's not sustainable. So we want to make it a permanent solution, right? And exercise The movement is actually what draws the nutrients in here so the body can heal and repair. That's what the body naturally wants to do. But as we get older, our ability to repair begins to diminish. So, arthritis is inflammation. Cartilage, tendons, ligaments are particularly vulnerable because they have a very poor blood supply. We develop scar tissue and adhesions, and it causes joint degeneration, and movement actually prevents that. So here's a spine, vertical spine, and we can extrapolate what I'm going to tell you to the shoulder, to the knee, or whatever joint of the body you want to talk about. So this is textbook, near normal. Nice healthy vertebra, nice healthy disc. Here's the spinal cord coming down, the nerves exit from it. When we begin to get dysfunction of the spine, we go into what's called phase 1 degeneration. The discs begin to dehydrate, motion begins to be restricted, sometimes nerves are interfered with. As that continues on, it goes to phase 2, and we start getting arthritic changes in here, spur formation. Discs dehydrate even more. The body begins to lose even more function. Discs can bulge and affect the spinal cord or nerve roots. Phase 3, this is a severe degeneration. It can actually become fused in there. All right.